Let's do a select all that apply question together, and I'll also go over a test taking strategy that will help you answer these types of questions on your exams. A nurse is caring for a client with sepsis secondary to a UTI. The client's blood pressure is 84/50, heart rate is 128, respiration is 28, temp is 103.1, and SpO2 is 90% on 4 liters nasal cannula. The client is increasingly confused. Which interventions should the nurse implement? Select all that apply. A. Increase oxygen delivery per protocol. B. Administer the ordered normal saline bolus. C. Hold antibiotics until urine culture results are available. D. Prepare to administer vasopressors if MAP remains low. E. Place the client in low Fowler's position to reduce metabolic demand. F. Obtain lactate level if not already drawn. And G. Administer acetaminophen for fever if ordered. When you have a select all that apply question, I want you to evaluate each answer option one at a time to decide if it is true or is it false. Don't overthink it. Don't compare the answers to each other. Just a yes or a no. Is it true or is it false? So let's look at A. Do we want to increase oxygen delivery? Yes, this is true. The patient is hypoxic. Giving more oxygen helps improve their oxygen level while we treat the cause. Now let's look at B. Do we want to give a normal saline bolus? Yes, the blood pressure is very low. Fluids help bring the pressure up and improve organ perfusion. Do we want to hold antibiotics until cultures result? No, we want to draw cultures before antibiotics are given, but for sepsis, antibiotics must be given right away. Let's look at D. Do we want to prepare or anticipate vasopressors if the MAP stays low? This is true. If the fluids don't improve the blood pressure, the next step is a vasopressor like norepinephrine. Our next option, do we want to place our patient in low Fowler's position? No, we do not. Make sure that you're reading this correctly. Low Fowler's would make it harder to breathe. The patient needs the head of the bed up to improve ventilation. So we would want something like high Fowler's or semi-Fowler's. Next option, do we want to obtain a lactate level? This is true. Lactate shows how poor the tissue perfusion is. It helps us identify the severity of sepsis. And our last one, do we want to give acetaminophen if it's ordered? Yes, we do. Lowering the fever helps decrease oxygen demand and the strain on the body. So your final answers for this question are A, B, D, F, and G. Who got it right?